How many are there? There are 4 heart chambers. And what is the atria? The atria are the 2 chambers which form the base of the heart and receive the venous blood. And the ventricles, doctor? The 2 chambers which lie anteriorly to the atria and propel blood into arteries. Doctor, what is the conduction system of the heart? Specialized neuromuscular tissue for the conduction of impulses. And the atrioventricular bundle of His? The bundle of His is a bundle of modified muscle fibers within the interventricular septum and walls of the ventricles. Doctor, what is the atrioventricular node? The AV node found in interatrial septum relays impulses to the atrioventricular bundle, which in turn causes the contraction of the ventricles. Doctor, what are Purkinje fibers? Purkinje fibers are cardiac muscle fibers of the conduction system which ramify beneath the endocardium. Doctor, what is a sinoatrial node? It is a sinus node, that is the SA node, a node situated in the wall of the right atrium. It is the pacemaker of the heart, since it transmits impulses to both atria, stimulating them to contract simultaneously. Doctor, the heart wall and covering is the endocardium? No, the interior lining of the heart wall is the endocardium. What is the myocardial sinusoid? Such a sinusoid is endothelial, and it is endothelium-lined spaces lying between the myocardial muscle fibers and enabling the ventricular myocardium to absorb blood in a sponge-like manner. Doctor, pericardium? Pericardium is a covering of the heart composed of a fibrous and serous pericardium. The former fits loosely around the heart. The latter consists of a visceral layer, or epicardium, which adheres closely to the myocardium, and a parietal layer which lines the inner surface of the fibrous pericardium. Doctor, the pericardial cavity is a narrow space? Yes, it is. Where is it? It is between the parietal and visceral layers. It contains a minimal amount of serum that serves as a lubricant. Doctor, what are the orifices and valves of the heart and great muscles and vessels? Well, they are the atrioventricular orifices and valves, which are openings and cuspid valves between the atria and the ventricles. Doctor, what is the mitral valve? The mitral valve, or bicuspid valve, is a valve between left atrium and left ventricle. It contains the endothelial folds, or cusps, which come together when the ventricle contracts. Doctor, what is the tricuspid valve? The tricuspid valve is 3 endothelial folds, or cusps, which guard the right ventricular orifice. Doctor, what is the foramen ovale? The foramen ovale is the reopening between the 2 atria in fetal life. It normally closes after birth. And the semilunar valves, those are half-moon-shaped flaps within the aorta and pulmonary trunk, which prevents the blood from flowing back into the ventricles. Doctor, let me ask you this. The sinuses, arteries, and nerves, that is, the aortic sinuses, the sinuses of Valsalva, yes, they are 3 dilated spaces of the root of the aorta related to the 3 cusps. sinuses of the aortic valve. Doctor, what is the coronary artery involved? There are branches of the ascending aorta arising from the right and left aortic sinus. These blood vessels with their branches supply the heart muscle and form numerous anastomoses of small arteries and precapillaries.